Bonus reading for home caregivers. Part 1. The Ideal Caregiver. Who is the ideal caregiver? The ideal caregiver is someone who fulfills all of the following roles and qualities. 1. Knows his or her responsibilities. 2. Knows his or her limitations. 3. Carries out his or her job professionally. 4. Maintains personal hygiene. 5. Maintains punctuality. 6. Maintains his or her own safety. 7. Has good observation skills and good initiatives. 8. Very open to suggestions. 9. Has a sense of humor. 10. Takes pride in his or her job. Responsibilities. The responsibilities of the caregiver include, but are not limited to, the following: routine personal care, hygiene assistance, laundry, cleaning, shopping, meal planning and cooking, rides to doctor appointments and errands, medication reminders. Limitations. The caregiver should know that he or she is at this home to care. She or he is not biologically part of this family and as such does not have certain rights. There are times when she may have access to a patient's personal information, like bank accounts, social security number, some identification cards, and other private information. The limitations of her job must always come to his or her mind. This information should not be discussed outside the home of the patient. The information should not, in some cases, even be discussed with the patient, as he or she may become suspicious and start feeling uncomfortable around her and possibly dismiss her from the job. The caregiver is not to make certain decisions for her patients. When some vital decisions are to be made, the patient's son or daughter or significant other should be called to make the decision. Professionalism. The free online dictionary defines professionalism as the expertness characteristic of a professional person, skillfulness by virtue of possessing special knowledge. From this definition, we can simply say that being professional means that one knows the skills of her job and delivers them with expertise. For a caregiver, do not feel intimidated that you are serving. Be very humble and carry out your responsibilities with expertise. The way you present yourself determines how you are valued and respected before your client. Remember that respect is not demanded, but commanded. It is also very imperative that caregivers wear appropriate clothing to work. Very tight-fitting jeans or pants should be avoided. Revealing tops should also be avoided. The best clothes to wear to a caregiver job are scrubs. I remember a certain day that a caregiver walked in and the aroma of the environment changed. I thought in my mind, does it mean that this lady cannot perceive this odor? I looked at the faces of those around me, and I saw that look. Other people were as uncomfortable as I was, but no one dared tell her what was happening. It looked like she left her scrubs in the washing machine overnight before drying it. But wait a minute. Couldn't she smell that? I started imagining what would happen when this lady bends over a patient to take care of him or her. That poor patient will definitely not find it funny. Should we maintain personal hygiene as caregivers? The answer is a bold yes. There is no such excuse as, I was late so I forgot to shower, or statements of that sort. Better be late and clean. Punctuality. According to WordNet Web, punctuality means the quality or habit of adhering to an appointed time. Caregivers need to adhere to the appointed time for the start of shift. I once interviewed one of my clients, and the old woman commended a caregiver I sent to her. She is always here by 9 a.m., very punctual. That made me feel very good as the employer. Sometimes caregivers could meet traffic or things of that sort. In order to maintain punctuality, leave your house earlier than you should to give room for traffic emergencies. The issue at hand is your arrival on time, not the excuses that made you not to. Maintenance of safety will be treated as a different topic. Good observation skills and initiatives. Do you know the game Bingo? If you have played Bingo or know about it, you will remember that it requires a lot of alertness, both in quick observation of the numbers and the ability to shout bingo first. The caregiving job is a little like bingo because it demands a lot of observation and alertness. Your patient has been left under your care. Erase it from your mind that she or he can stay without you. Have it in your mind that, as far as you are in that house, she is under your care and so deserves your complete attention. Observe for mood changes, signs of hunger, pain, etc., which she may feel uncomfortable to voice out. Ask open-ended questions like, "I see that your face is not very bright. Is there something you want to talk about?" Be very polite and do not push for the patient to give you the information that she does not want to. Initiative means embarking on new ventures. In the case of senior care, I would explain it to mean the ability to think fast of the solution of an immediate problem. An example is this. You find your patient slumped all of a sudden while eating at the dining table. What do? Many ideas run through your mind like, run, call the daughter or son, call 911, call your agency, start CPR. All these ideas are very vital and should all be done, except of course, run, but should be placed in the correct order, and this is the correct order. Call 911, start CPR, but if you suspect a fracture, stop and don't move the patient. When the emergency team arrives, call the significant other, then call your agency. In the case of an emergency as described, be sure to give accurate information to the emergency team. Give as much correct information as you know, and only those needed for the care. Openness to suggestions. The caregiver must be open to suggestions given by her agency and the family. It is always good to remember that you are there to serve. Has a sense of humor. When I started practicing as a nurse, I would come to work, take my duties so seriously, trying to be the best nurse, do my job, and go home. As time went on, I started finding out that my colleagues were not so comfortable with me. Why? I soon found out I was too serious with my work. It was not until I brought my real funny self and started expressing my sense of humor that everyone started changing their minds about me. Season every second as much as you can. That will make you enjoy your job and feel at home to leave your house the next day. Moreover, that will make your clients want you to always be there for them. Takes pride in the job. Have you ever seen someone who hates his job? He makes a lot of mistakes at the job, creates a lot of bad impressions, gets depressed on the job, and never retains one job for too long. I want to say that the caregiving job is a noble profession because it is not everyone that possesses the gift to care for others. So, my dear caregiver, take pride in your job. The caregiver needs to feel good about themselves. If you don't feel good, you won't respond well to a difficult situation. Kathleen O'Brien. More explanations on the ideal caregiver. A caregiver can be anybody who helps a person when he or she is in need of it. In general, people suffering from acute illnesses need the help of caregivers. An ideal caregiver is one who, in addition to looking after the patients, also helps them with their grocery shopping, house cleaning, cooking, shopping, paying bills, giving medicine, bathing, using the toilet, dressing, and eating. Individuals who do not charge a penny when it comes to taking care of patients are referred to as family caregivers or informal caregivers. If your loved one is suffering from an acute illness, you can be by his or her side to help. Most health centers may need patients to have a caregiver for helping them throughout the treatment. As a caregiver, you need to provide emotional support to the patient. In addition to this, you need to also act as his or her advocate. As a caregiver, your prime responsibility lies in playing a viable role in the treatment and recovery of your loved one. You need to learn more about your patient's disease as well as treatment options, as it will help you make good choices about your care. Role of an ideal caregiver. As a caregiver, you need to remember that you are an eminent member of the healthcare group. You need to play a viable role all through the patient's treatment, starting from planning to recovery process. It is quite obvious on your part to feel thrown into a strange world of test results, treatment choices, and medical terms if your loved one is suffering from any acute disease. You may have to gather all possible information on earth about the disease, consult doctors, and stay by your patient's side supporting him or her. In simple words, that's what we call an ideal caregiver. Each patient's needs are different. For example, a patient suffering from autism will have different needs when compared with a patient suffering from Alzheimer's disease. Hence, as a caregiver, you need to find your own way of catering to those needs. Irrespective of the different needs, what is expected from an ideal caregiver is love and support throughout the treatment, recovering, or peaceful death procedure. Taking up the responsibility of being a caregiver may turn out to be an overwhelming job. In fact, it helps if you are aware of your job and responsibilities. As a caregiver, your first job involves finding out the expectations of the hospital, or rather the doctors, from you. Many health centers provide special sessions for helping caregivers learn what they need to do when it comes to taking care of patients. For home caregivers, you need to find out the expectations of the family from you. Talk to your patient about what they need. For instance, some patients may need only emotional support from you and leave the task of talking to doctors as your advocate to others. On the flip side, some patients may ask you to take up their complete responsibility, starting from grocery shopping, giving medicines, to providing emotional aid. You need to act as your patient's advocate. In other words, you need to act as an active supporter of your patient. You can act as your patient's advocate in a number of spheres, such as medical. Being an active member of the healthcare group, your job lies in gathering information, talking to the physicians together with taking care of the patient at the time of his or her recovery. Financial. If your patient has asked you to look after his or her financial matters as well, then you may talk to the insurance and manage health costs as well as routine household finances. Emotional as well as social. Be by your patient's side and listen to what he or she has to say to you. You can maintain regular updates about your patients in any way that can only be accessible to you. You can write down the names, maps, phone numbers, questions, instructions, and much in a diary. As a caregiver, you need to see to it that the medical team answers all your queries. If you can't be available when the doctor pays a visit to your patient, you can fix a time according to your convenience for talking about your patient's progress to the doctor. Don't be scared of asking questions regarding the patient's progress till you get a satisfactory answer. There are quite a few things that may take place just as expected. Complications may take place, and the recovery period may last for quite a while, longer than expected. You may come across a situation when you need to readmit your patient no sooner than you have brought him or her home. An ideal caregiver is one who plans for setbacks, surprises, as well as delays. Try focusing on things that you may manage at present and measure the progress of your patient in small increments. There is a lot to caregiving, even after the patient leaves the clinic or hospital. In fact, the real caregiving job starts off at this juncture. During the first weeks or months after your patient returns home, things may not be that normal. Being a caregiver, your job involves administering medications, changing colostomy bags, checking the patient's blood sugar, as well as monitoring the patient for infection, as well as other complications. Taking the care of a patient at home is much more challenging as compared to taking the care of a patient when at hospital. Family members as well as friends may not always understand the hardcore truth that difficulties never come to an end after the return of the patient from the hospital. In fact, this is the time when a patient needs maximum support from the caregiver. While dealing with a patient, your prime responsibility lies in maintaining an optimistic outlook and a good sense of humor. It is true that dealing with a patient suffering from acute illness is not a matter of joke, but many caregivers know that by maintaining a good sense of humor, they have helped patients to cope with their illness. An ideal caregiver adjusts to the needs of the patient. The need of a patient at the time of the diagnosis will certainly differ from his or her need at the time of the recovery procedure. An ideal caregiver is one who is familiar with the changing responsibilities well in advance. Over and above, this approach of his will help in carrying out the below-mentioned transactions more conveniently. Helping your patient in preparing for the treatment. Caregiving at the hospital. Caregiving after the patient returns home. Sharing your caregiving responsibilities with others. For caregivers who are part of the family, you may try sharing your caregiving role with others. Even if you play the chief role in managing the aforementioned areas, you can always delegate some tasks to others. In fact, if you want to be an ideal caregiver, then you need to take utmost care of your own self as well. Hence, it would be advisable on your part if you assign small tasks to others and use your energy in helping the patient, which they need you the most. Often, an individual acts as the main caregiver of the patient. Despite this fact, at times it becomes difficult to carry out the task single-handedly. To avoid this situation, a group of individuals can work jointly as caregivers. When a group shares the role of caregiving, communication and organization are keys to success. Meeting your own needs as caregiver. Many a time, caregivers neglect themselves while taking care of others. This could work out for short-term caregiving, but in long-term caregiving, it definitely will lead to problems. Some problems that could occur when caregivers put themselves last include, but are not limited to, 1. They're becoming ill. 2. They're hating the job. 3. They're becoming depressed. 4. They're not delivering appropriate care to their care recipient and thus suffer both themselves and the care recipients. One of the problems that caregivers usually face is the problem of time. When someone starts the job of caregiving, it will not take long to discover that the extra time that was once available is no longer there. This is a big issue, and that is why the solution needs to be discussed. Have you ever wondered why the United States made 3 12-hour shifts the full-time job for healthcare professional, for those who run 12-hour shifts? This is because they want to prevent the burnout associated with caregiving. I cannot count the number of times that I forgot to eat while I was working in the hospital. It will start by me saying, I will eat in 15 minutes. And then 15 minutes turns into 30, and 30 turns to 2 hours, and sometimes no food till the end of the shift. I cannot count the number of times I had to run into the pantry just to grab an apple juice because my body needed some food. I did not do this every day, but I certainly cannot count how many times I have put myself last. From my inquiries, this is not just my problem, it is the problem of many caregivers, putting ourselves last. In order to prevent burnout, frustration, and depression that accompanies caregiving, it is vital to keep some time during the day for yourself. When I learned this principle, I would gladly hand over my responsibility to the next person and go for lunch or just for a break. In home care, it will depend on the number of hours required of you. If you are doing a 4 to 6 hour job, then you can do without a break. But if it is longer, find time to take care of yourself. I remember a day in the hospital that 2 nurses were quarreling because one nurse was almost urinating on herself while the other one was still in the restroom. The question now arose, why did this nurse wait till the last minute before going to the restroom to urinate? The answer is simple. She put herself last. In home care, find time to go to the restroom when it is safe so that you do not endanger the safety of the one receiving your care. Imagine holding a patient in your hands who is depending on you not to fail, and at that same time you are trying to hold back your urine from dripping on your pants. Meeting your own requirements is important as well. In other words, if you want to be an ideal caregiver, then you need to stay in good health. An ideal caregiver is one who, in addition to taking care of the patients, takes care of him or herself as well. When a person is diagnosed with an acute illness and is struggling in between life and death, people are so engrossed with the patient that they often overlook that the most important partner of the patient is the caregiver. Caring for a person suffering from an acute illness often turns out to be an emotionally draining as well as physically challenging venture. Watching your loved one passing through strenuous medical procedures may change the mind of the most optimistic and healthiest caregiver. Not only this, some caregivers feel that their physical health have declined to the considerable extent over the years due to the physical and emotional strains involved in the caregiving job. To avoid these consequences, this book introduces some vital points that would help them in meeting personal needs as caregivers. Caregiving is a responsibility, and breaks are your deserved right. Hence, be sure to reward your own self with occasional breaks. Look out for symptoms of depression and never delay when it comes to seeking professional help. The sooner you get better, the sooner you will be able to take care of your patients. If people come forward to share your responsibility as a caregiver, don't hesitate. Instead, assign them simple tasks that they can carry out easily. You can assign them some of the daily as well as weekly tasks. Talk to your friends or try spending some moments away from the patient. You can utilize this time in doing anything that helps you feel relaxed. Check out something that reminds you about the most pleasurable moments of your life. Talk to someone who can provide you emotional support. Friends and family members are of great help at this point of time. They are good listeners with whom you may share your feelings. Professional counseling, talks with support groups, and clergy are always good ways of support. Concentrate on the significant tasks. Keep your energy reserved for helping your patients with things they need the most. You can't be an ideal caregiver if you are sick or exhausted. Hence, try eating well-balanced meals, exercise regularly, and sleep well. Devote some time for your own self. Whether you go for a movie, a walk, or visit your friend's place, your prime objective should be to take out some time for yourself. Ask your family member or friend to act as your advocate in the like manner as you act as your patient's advocate. Your advocate may keep an eye on you and provide you with the support as well as the time you crave. Appreciate your own self for your caregiving job. At times, people are so busy with the patient that they simply turn a deaf ear towards the efforts put forward by the caregiver. At times, even the patient is too tired and sick to reward your efforts. Take adequate care of your back, as your caregiving job may demand too much of pulling, pushing, and lifting. Have faith in your instincts, as they are most likely to show you the right direction. It has been mentioned earlier that individuals who do not charge a penny when it comes to taking care of patients are referred to as family caregivers or informal caregivers. Let us now check out a couple of suggestions to help family caregivers when it comes to taking care of the patients. As a caregiver, you need to jot down all your questions in pen and paper so that you don't forget them. Try being clear when it comes to talking about the patient to the doctor. Don't ramble up things at this juncture. If there are innumerable concerns that you need to discuss, then try going for a consultation appointment. This approach allows you, as well as the physician, to discuss the progress of the patient in an unhurried manner. Keep your own self updated about the disability or disease of the patient. You can also surf the internet for this purpose. Check out the routine at the hospital or doctor's chamber so that you can find a suitable time to discuss about the patient's progress. Keep aloof your anger and your sense of helplessness about not being able to help your patient. Keep in mind that the doctor will try his level best to recover your patient. Caregivers generally share a close, if not too close, relationship with their patients. Each caregiver and patient is in no way similar to each other. Sometimes the viewpoint of a patient is likely to differ from the viewpoint of a caregiver. Hence, it would be advisable on your part if you try talking to your patient and, in the process, to find out what he or she needs at each and every phase of illness. An ideal caregiver is one who adapts his or her service for addressing the needs of the patient. The patient and the caregiver need to discuss their expectations, i.e., what sort of responsibilities they need from each other. If possible, they can also jot down their agreement in pen and paper in the form of an agreement. For being an ideal caregiver, you need to know the difference between doing and caring. Welcome ideas as well as technologies that promote the independence of your patient. Try updating your own self about the condition of your patient and make sure to communicate with the doctor in an efficient manner. Good communication is believed to be the most valuable quality of a caregiver. In fact, this quality turns out to be more important when caregiving is an immediate family member. There may be times when the patient feels hesitant to speak about his or her actual health condition simply because he or she feels that by doing so, he or she will burden the caregiver. An ideal caregiver is one who is an expert in time management skills. Often they need to keep up with full-time jobs in order to take care of their loved ones. In addition to this, they need to also monitor the financial stress that goes hand in hand with caregiving. It is true that the life of a caregiver is full of challenges, but there are innumerable rewards as well. In fact, in the caregiving process, most caregivers develop a better relationship with the patient they are looking after. Moreover, adequate caregiving makes an individual spiritually as well as religiously sound. In a nutshell, caregiving leads to stronger relationships and helps in maintaining an optimistic outlook on life. The difficulties that come with caregiving may be overcome with effective communication. The rewards that come with caregiving often make up for the hardships associated with it. Keeping yourself safe as a caregiver. The following areas should always be borne in mind by the caregiver for safety. 1. The 5 senses. 2. Information. 3. Sexual behaviors. The sense of hearing. Sound is an important alert for safety. It can indicate that your patient has fallen, that someone is trying to break into the house, things of that sort. The caregiver must always be sound alert. When left alone with your client and the doorbell rings, do not open the door if you do not know the person. Some bad person may know that everyone has gone to work and you are left alone with this sick person, and so decides to trick you into opening the door yourself, which of course will not trigger alarms. The sense of sight. This has earlier on been mentioned under observation skills. Careful observation should be part of the caregiver's skills. Some examples where the sense of sight could be tools for safety include the observation of unusual movement around the house, which could be a criminal. Observation of your client to see changes in his mood and behavior on time. Take the necessary actions and save yourself troubles that could arise out of your neglect. The sense of touch. Always react to any feel of undue wetness. If this is noted on the floor, dry it without waste of time to avoid falls. If it is on the bed or diaper, change the client to avoid pressure ulcers. Using your sense of touch, always take note of your client's temperature becoming warmer than usual. Could he or she be having a fever? The sense of smell. This tells you if something is burning, which of course should be investigated. Shut off to avoid fire. It may also tell you when your patient is wet. The sense of taste. This will be mostly used if you are preparing meals for the client. Information. Keep watch for useful information that could affect both your safety and the safety of the caregiver. This could be information on fire around the neighborhood, flood, earthquakes, and the sort. Any information that could hamper your safety or that of your client should be of paramount importance to you. Sexual behaviors. Bear it in mind that a lot of caregivers have had issues of sexual assaults in their records, and that many of these people are probably innocent. So, in order to keep yourself safe during the caregiving job, avoid comments or behaviors that can easily be misunderstood. An example is when changing the diaper of an old man and you observe his penis. Forget your professionalism and start asking him if he was circumcised. Also, avoid touches that may be misunderstood as sexual harassment. More information on keeping yourself safe as a caregiver. Caregivers' minds encircle with questions, but with the call of their duty, they forget to distinguish that there are some things which are beyond their limit. They try to achieve them, and unfortunately, in the process, they tend to lose spirit and motivation, and thus their mental and physical health deteriorate. Caring for an individual who is suffering from a severe disease can be challenging. In the case of caring for Alzheimer's disease or any related dementia, there is the possibility that the caregiver can become frustrated and irritated. If they are ignored and not treated, they can become depressed, and that ultimately can lead to serious consequences for the person caregivers care for. Thus, it is not only necessary for the person the caregiver is caring for, but it is also important for the self-belief and the satisfaction of a caregiver's job. Why care for a caregiver? Frustration often arises when a caregiver tries to change some uncontrollable situations, and this frustration can even arise from any daily activities, like bathing, dressing, and eating. When a caregiver is taking care of some serious cases, like the bone marrow or cord blood transplant, it can be really stressful. The patient's behavior can also become irritating to caregivers. Examples are when a patient is wandering or repeatedly asking questions. The caregiver has to be patient and overcome their frustration and stress, because the fact is that the caregivers are entrusted with the duty of caring for the patient, and not the other way around. If you are a caregiver, taking care of yourself is not only about taking out 15 minutes and spending some time with your friends. Rather, it is more about finding someone who will be able to give you emotional support and can really motivate you to get your fit into the role. A caregiver's life. The caregiver's stress can lead to an emotional and physical strain, thus leading to frustration and anger while taking care of the patient. In some cases, the person may feel guilty, thinking that he or she is not able to deliver the best of the care to the patient. There may be feelings of loneliness and exhaustion. These mentioned factors can lead to serious complications, but the good news is that these complications can be avoided. The warning signs. Some of the signs of frustration are headache, chest pains, lack of patience, stomach cramps, knot in the throat, compulsive eating, shortness of breath, increased smoking, desire to strike out, regular alcohol consumption. For combating all these symptoms, it is necessary that a caregiver should respond to an extreme frustration, and for doing that, you need the following. Help yourself to learn the signs and the symptoms. Intervene or calm down physically. Thought modification process can be helpful for reducing your stress. Assertive communication is necessary. Seek help. When you are caring for others, the precautionary steps are different for different diseases. There are even some precautionary steps which you should take for yourself, so make the process easy. It is necessary that you should make some plans that will help both you and the care recipient. Keeping yourself safe. Caring for yourself should be your first priority, because when you are able to love and care for yourself, then you can assume the role of a caregiver. Thus, watching for the warning signs for the frustration is important, as you can intervene with the immediate activity to calm down. Calming down is necessary when there are any tensed situations involving the patient. Trying out these simple processes could be helpful. Count 1 to 10 slowly and take a few breaths. Take a brief walk to another room and collect your thoughts. Any uncontrollable situations should be left for the moment and, if possible, avoid any self-reaction. You can even try reading, praying, meditating, singing, music, or taking a bath. Practicing relaxing techniques at last for 10 minutes in a day. If possible, try to recall the whole situation and replay in your mind all that happened and what you should have done to make the situation better. This is a very useful tool which will help to reduce some of the stress from the job. There are many situations which affect how you feel, and there can be feelings of frustration from any such different circumstances. If you are able to analyze these situations and follow the thought patterns which are adaptive in nature, then there could be a buildup of self-defense against frustration. Also, trying to transform unhealthful thought patterns into adaptive and positive thought patterns can be useful. Some of the common thought patterns are: you can take up some negative thoughts and multiply it with something else. For example, when you are becoming ready to take the patient to the doctor, the car breaks down, and you tend to think that something always goes wrong whenever you are taking him or her outside. You tend to overlook good situations and hardly ever think about motivation like, I can do more. Rather, you capitalize on the bad moments. Sometimes you may even jump to a conclusion without being aware of the facts. You tend to think of others thinking negatively of you and your duties, and thus you unconsciously show that in your actions. As said earlier, take pride in your job, motivate yourself, and make the most of the moment. Carry out your duties in such a way that the client will see you as the ideal caregiver. One of the most important things for the caregiver is to have the right amount of sleep, because deprivation of sleep can cause moodiness, and thus it might affect the caregiving process for the patient. Quality sleep is important, and it is not just about the hours you sleep. It is more about the requirement of the body. Since caregiving jobs may involve getting up early in the morning and remaining alert throughout the day, perhaps you need more sleep. In many cases, the caregiving duties are split into shifts, like night and day shifts. When you are not on duty, make sure to take enough rest. If it happens that you are the only one that does all the shifts, ask for help, so as to rest yourself and be healthy to meet the demands of the job. Some of the common ways of decreasing your stress as a caregiver could be explained in a nutshell, like the following. 1. Arrange a meeting with your family when a loved one is diagnosed. This will enable each family member to decide on how much they can contribute towards a paid caregiver. That way, you will not suffer because you are the only one at home with the senior. 2. Self-care is necessary because if the caregiver becomes ill, the entire caregiving process is disrupted. If the caregiver is not well, then it is better to hand over the task to someone else who's trustworthy, someone from the family or from outside. 3. It is necessary to take care of the stress levels which you are facing in the process of caring for the patient. There could be some early warning signs for potential problem, and it is important to check them out so as to maintain the caregiving process. 4. Meeting physical needs. When you are taking care of someone, it is important for you to be 100% fit and sound, and this can be possible when you are consuming proper, healthy food, having sufficient rest, and having time for recreation and relaxation. 5. Honesty counts. If you feel that you are not able to meet the mental and physical demands of the care of the patient, being honest with your inabilities will certainly help you. 6. Making legal and financial plans on the forefront. It is necessary to take care of the advanced directories, like healthcare surrogate, living will, and power of attorney, which will help you to take care of the business in advance. 7. Realistic approach. Be hopeful, but keep yourself grounded with the realities of the moment. It will help you to reduce your stress up to a certain level when you are able to balance the hopefulness and realities related to the condition of the patient. 8. 100% not possible. It is wise to accept the fact that there can be certain situations where you may not be able to provide 100% perfect care of your loved one or whoever is the patient. Be cautious and never overdo anything, because that might cause problems to the patient and thereby enhancing your stress level. Avoid guilty feeling unnecessarily. Learning to say no is not a guilt, and there could even be times when you won't hear the word thank you. However, be patient and learn to deal with feelings of grief and anger. 10. Praise yourself. You are not a superhero or a saint, but as a human being, you have given your best, and you have been able to handle numerous responsibilities with a great deal of stress. So, praise yourself, even if no one else does. Communication skills. Good communication with the patient or to someone related with the patient is very important. It helps you to know what is expected of you and makes you feel safe to express yourself so that others could understand your limits and needs. The process of assertive communication is different from passive communication or aggressive communication. Passive communication is a form of expression that is ineffective and maladaptive. Those with a passive communication style are generally afraid of confrontation and do not feel they have the right to make their wishes and desires known. This style of communication can lead to feelings of anxiety, anger, depression, and helplessness, and is common among those with social anxiety disorder, SAD. Passive communication is based on compliance and hopes to avoid confrontation at all costs. In this mode, we don't talk much, question even less, and actually do very little. We just don't want to rock the boat. Passives have learned that it is safer not to react and better to disappear than to stand up and be noticed. From the descriptions given about passive communication, it is clear that this is not the type of communication that the caregiver needs. Aggressive communication always involves manipulation. We may attempt to make people do what we want by inducing guilt, hurt, or by using intimidation and control tactics, anger. Covert or overt, we simply want our needs met, and right now. Although there are a few arenas where aggressive behavior is called for, i.e. sports or war, it will never work in a relationship. Ironically, the more aggressive sports rely heavily on team members and rational coaching strategies. Even war might be avoided if we could learn to be more assertive and negotiate to solve our problems. Having seen the above two types of communication, we may want to look at assertive communication. The most effective and healthiest form of communication is the assertive style. It's how we naturally express ourselves when our self-esteem is intact, giving us the confidence to communicate without games and manipulation. When we are being assertive, we work hard to create mutually satisfying solutions. We communicate our needs clearly and forthrightly. We care about the relationship and strive for a win-win situation. We know our limits and refuse to be pushed beyond them just because someone else wants or needs something from us. Surprisingly, assertive is the style most people use least. Some of the important keys to assertive communications are: respect your own feelings, desires, and needs. Speak about your feelings without any hesitation, shame, or humiliation. Use I statements rather than you statements. Use words like "it's important to" rather than using "should" in your statements. When you feel that it will not be possible for you to continue as a caregiver, then it is better to accept this fact because that will not be favorable to you alone, but to the patient as well. It is wise to discuss your needs along with the family members and friends, and you will be able to share the caregiving responsibility. It is quite natural that people will not realize when you need help or assistance. Therefore, you should take the initiative to ask for help and express your needs. If someone offers help, don't refuse because there could be errands or tasks you need to attend to. More information on communication. When your loved one is suffering from diseases like Alzheimer's or dementia, it can be a really difficult task to get the right communication. It is usually very difficult to convey the message across their senses, and if they are not able to perceive, then you cannot blame them because the decreased level of perception is consistent with these types of patients. There can, however, be certain times of the days which can be worse or better, when they will be able to understand what you want to communicate and respond accordingly. There can also be times when they sit still and it will be like talking to a stone idol. Whatever may be the case, it is necessary to understand their needs and demands, understand them, and communicate effectively. So, here are 5 positive communication techniques which will help to get your message right across towards the patient, and thereby fulfill the caregiver's duty towards the patient. The first and foremost thing that is necessary is to put ourselves in their shoes. That is essential because unless you are able to understand their problems and inabilities, You won't be able to take off the righteous methods to communicate with them. The person suffering from dementia needs to be knowledgeable about his or her disease, and that should not be done by force. There is no need to give them any gentle reminder or correction, because that could be psychologically damaging. It is better to congratulate them rather than correcting them, as it will be easier to cope up with the situation. So improve this part of communication with them and offer them the support and validation they want. Another important factor that you need to keep in mind is to place the right kind of communication with the healthcare providers. It is necessary to convey all the problems and difficulties the patient faces. Recognize and demonstrate wellness habits of the patient to the doctor. You need to recognize all the signs and symptoms of the common chronic illness and have to abide with the process of treatment and the lifestyle changes that is required for the managing of the chronic illness. Using effective communication techniques and strategies for the older adults and reorganizing and responding to the challenging behaviors of the older patients. If you are not well aware of the communication techniques, you can plan a doctor's visit and learn communication practical skills from them to conduct an effective communication with the doctors, nurses, home health workers, and healthcare providers. Allow the elder person to express their feelings because it will help them to disclose some hidden feelings of significant loss. If they don't express, they will tend to develop sadness and grief, and may in turn lead to more deterioration of their health. Sit with them and try to make a space so that they don't hesitate to share their inner feelings. Since an elderly patient has various life experiences, it is important to allow the person to share their thoughts, and it is necessary to listen and respect them. Try out these techniques, as they may be challenging at times, but it's worth the effort. Cultural sensitivity in home caregiving. Performing a routine task for the toddlers or patients is similar to what we generally do for our own family. The point is to be at the demarcation line where caregiver services are to be peddled, but keeping the professionalism intact. Caregivers need to be aware of cultural differences. That's why I have chosen to address it in this book. Conflicts should be avoided because of cultural differences. That is why the caregiver should do an assessment of the client at the beginning of her job, to know what the client likes and what she or he does not, to know what he believes in or does not. This will encourage a smoother communication and help build a therapeutic relationship faster. Listening carefully and respectfully to the values and beliefs of the patient and respecting them in your day-to-day activity is what is referred to as cultural sensitivity. Culture is referred to as the way of life of the people. I knew this definition from my high school, so I do not know the source. So when we are saying that the caregiver should be culturally sensitive, we are saying that the caregiver should respect the way of life of her client. Culture is made of values, beliefs, and practices, and they are shared by some group. Children inherit culture from their elder ones, and it lasts throughout adulthood. Advantages of cultural sensitivity. Person becomes competent and confident. A stronger connection with the client and the family members. Families share a trusting relationship with the caregiver. Effective meeting with families and children. Expansion of knowledge. Avoidance of conflicts. Follow these simple tips and avoid conflicts with the patient. Reflect on the caregiving practices and analyze the things which are being done or performed. Observe the interactions of the close ones and relatives with the patient. Differences may arise with the relatives, but it is better to acknowledge them as it will reduce anxiety and confusion. Ask for more information and learn about the relatives and close ones' perspective and clarify every point of view. This will help to handle situations or any issue arising from the patient's abnormal behaviors arising out of cultural sensitivity. Communication is the best way to negotiate with any differences arising out of cultural sensitivity. So, check out these few tips. Building a trusting relationship with the close ones and relatives of the patient. Determine the level of commitment necessary to resolve the problem. Identify problems in words and decide the plan of action. Escorting and transporting your patient. Dealing with patients requires a lot of care and professional expertise. Escorting and transporting a patient implies monitoring the mental and physical state of the person during the whole journey. A person who is escorting and transporting a patient is fully responsible for observing any signs of discomfort or anxiety during the journey. In the event of any kind of discomfort or anxiety, the caregiver should take all the required steps to alleviate the cause of discomfort with the help of their skills and expertise. Escorting a patient should not be confused with accompanying a patient to a destination. Both tasks are different from one another, and they should not be confused. A person's relative or friend may accompany a person, whereas escorting a patient is a professional role, and hence this task is generally conducted by professional caregivers like health or social care professionals. Before transporting a patient, the personnel who is handling the patient should make sure that the client is properly dressed for the occasion. If the destination is the doctor's office or the mall, it is important to dress the senior with a cardigan to guard against the coldness usually associated with these areas because of the air conditioner. While in the car, make sure all buckles and buttons have been pressed. If the person is in a wheelchair, make sure the knots holding the wheelchair to the floor of the transport has been knotted. If it is a car, make sure the seatbelt has been put on. Whatever the case, your security, as well as the security of the client, are of paramount importance. Before escorting the patient, the caregiver should be familiar with the appropriate destination well in advance. The anticipated time of return should also be discussed with the patient, and in the case of delays, the mobile and phone numbers of the concerned people or units should be with him or her. Escorting and transporting a person are generally for the purposes of attending an appointment, e.g. to a doctor's chamber, court, or housing department, requiring an assessment outside the hospital for, e.g., home, transferring from one place to another, or taking the patient to an inpatient department of a medical unit. A person who is escorting and transporting a patient should be aware of the medical history and the clinical condition of the patient. There should be provision for water, as while traveling the patient's mouth may become dry. Toilet and food breaks should be ensured in consultation with the patient throughout the journey. Medication should be provided as prescribed, and if the medication should be taken with food, there should be a stop for food during the journey. After the escort and on return, the caregiver must make an entry in the patient's record. The record should contain elaborate details identifying the reason for the escort, the patient's behavior, and the outcome of the escort. The details of any accidents or incidents that occurred during the escort should also be recorded in the patient's records. In home caregiving, if there were no incidences, there will be no need to make any records. The above-mentioned points should be taken into consideration when escorting and transporting a patient. They require a lot of care and attention, and more importantly, the understanding and love of the caregiver who is taking care of them. Fire and safety preparedness. Every year there are innumerable residential fires that lead to damage of property or loss of life. While damage to property can be recovered, but what if someone loses his or her life? As an ideal caregiver, your prime responsibility lies in adapting fire and safety measures and protecting the client in case a fire breaks out. By adhering to fire and safety measures and being vigilant, a home caregiver can lower the risk of a fire breakout to a considerable extent. Some of the probable reasons of a fire breakout are smoking, cooking, and a couple of other fire hazards. Let us now take a closer look at how an ideal home caregiver can prevent fire breakouts from taking place. Cooking. While answering a phone call or stepping out of the house, the burner should be turned off. While handling hot pans and pots, oven mitts should be used. While preparing a meal, the cooking oil should be heated in low flame. Avoid putting flammable towels as well as mitts on the stove. Smoking. The lighter and old matches should be disposed. The matches, cigars, as well as cigarettes should be kept at a safe place. Make sure the patient never lies down while smoking or consuming alcohol. Dropped butts need to be disposed in large tin cans at the earliest convenience. For the elimination of ashes, large ashtrays should be used. Additional precautions. Ask a professional to clean the fireplace chimney frequently. Opt for extension cords that come with circuit breakers. Avoid overloading the circuit breaker. The electrical cords should not hang from the bookshelves. The electrical panel should be inspected on a routine basis. You can appoint an expert electrician for this purpose. A good quality security system needs to be set up in your house. The yard as well as the house should be well lit. If you are escorting the patient to the hospital, make sure there is someone to keep an eye on the house. The yard, garage, as well as home needs to be free of rubbish as well as combustible items. There needs to be a provision for a fire extinguisher in the house. The windows as well as the doors need to be free from obstructions for easy and safe exit. A smoke detector needs to be installed in the house. The electric smoke alarms should be checked on a consistent basis. Try cleaning the alarms every 6 months. The battery of the alarms need to be changed at least once in a year. Keep the doors and windows closed while the patient is asleep, as this provides some prevention against fire. It is hoped that the aforementioned suggestions will help an ideal home caregiver in preventing his or her patient, as well as other members of the family, from the disaster caused due to a fire breakout. Phone etiquette for a home caregiver. The telephone is a part of daily activity, and for a caregiver, it is part of the requirements of the job. Since it is a part of the areas where caregivers have to walk and talk, there are certain things which are essential to follow as a part of the telephone etiquette. In every good caregiving course, telephone etiquette is a part of the curriculum. This is because it is certainly important to prevent treating the elderly or the people on the other line rudely or abruptly when communicating. The caregiver helps in conveying any emergency problems to the doctor or to the family members. In the process, there could be the possibility of the caregiver showing bad manners while speaking on the telephone to address the patient's problem. That is why good etiquette is needed. There could also be the tendency to be short or become the salesperson in most of the telephone calls. Have you ever had an experience with someone who is just rude on the phone, or someone that wants you to explain things hundreds of times to the amount of frustration? If you have had any of these experiences, then you will understand why the caregiver needs to adopt good phone manners. Politeness and simplicity are not the only manners needed in conducting proper phone etiquette. There are certain other things as well. Talking of the proper way to answer the telephone, except hello, nothing is accepted as the proper way to start addressing the other person on the phone when answering from a non-business phone. Using words like yes is considered inappropriate in telephone etiquette. The individual calling tends to draw a quick conclusion, and therefore the person sounds cold and aloof, and will hesitate to communicate effectively. As a caregiver, when you are calling someone, it is better to address them properly, and generally, it is better to start this way. May I speak to Mr. Blank, please? And in case the person who is being asked for is not present in the house, then a proper way to tell, I am sorry, Mr. Blank is not available at this time. Can I take a message? Don't utter anything abrupt, like no, because that reflects your negativity on the caller. Even if someone calls the number of your client mistakenly, it is better not to hang up, but to politely say, I am sorry, but this is a wrong number. When you are making a telephone call to the doctor or to the relatives of the patient at odd times like late in the night, any call after 8:30 p.m. is considered late. It is necessary to be patient and courteous while describing the person's emergency. In case of wrong dialing of the number, expressing apology is a must. When you are not with the patient and you are communicating with him or her on the telephone, it is important to be patient and calm with your voice to get across the message to your patient. In a nutshell, here are a few of the phone etiquette tips as a home caregiver. Be very calm, calculated, and patient on the phone. Remember that you are representing your client, so be very professional. Do not pass out your bad emotions to persons on the other line. Dialing wrong numbers demands prompt apology and not hanging up abruptly. Calling any business nearing the closing time should be avoided if possible. When you are calling any health professionals or doctors, stay short and informative as they are generally busy people.